Hello, my name is Dr. Cheryl Burdette, and I'm the Educational Director for Origins Incubator. And today in our class discussions, we are talking about that all-important impact of stress. And so even though we know that it's fairly ubiquitous and that at some point it'll affect some of our patients some of the time, but will often affect most of our patients most of the time, it's probably one of the hardest things that we deal with clinically. So rather than get lost in a web of all the stress that could be out there and the difficulties that surround it, we talk about how do we break this down and how do we begin to think about it clinically. One of the things that I learned from Dr. Linda Mattioli, who I have the pleasure of working with at Origins Incubator, the founder of Origins Incubator, is that she was very clear right at the beginning that there'd be some patients that wouldn't move forward until you address the stress component. So within the program, we talk about how you have to think about what your solutions will be to this. And so for her, as she was very clear that involving somebody that was that worked with counseling would be even part of her core membership package. From there, then we think about other additional adjuncts that we want to utilize and get really grounded in at least a couple of strategies that can be applicable to most of the stressful situations out there. One that we're going to focus on today is that of adrenal stress and looking at testing. And so for many of us, we began to think, well, how important is this testing? We know that our patients are facing more stress, so does the test really need to be done? And of course, the answer is never an absolute yes or an absolute no. But there are times where this becomes hugely to our patient's advantage. The first is that many symptoms of stress can present in a similar way. They can present with fatigue or insomnia. They can present with unexplained weight gain or symptoms that just don't seem to shift when our normal strategies aren't working like they should. However, those manifestations can often happen either from very high stress hormones, like higher output of cortisol, as well as lower stress hormones, lower output of cortisol. So unless we're measuring it, it's unclear which direction we should go in. Also, it gives us pertinent treatment patterns. For example, in addition to looking at cortisol, we'll see what's happening with DHEA, one of our major stress hormones. And DHEA is fascinating because it, of course, converts to testosterone and helps to fill in much of our hormone pool. But a major reason that DHEA gets blocked and no longer converts to testosterone is exactly this pattern of stress. And so if we see somebody with low testosterone, it makes sense to look at what their adrenals are doing, because if their DHEA is high, but yet testosterone is low, we know that that pathway is not moving like it should. And a key reason that happens is because of an overactive stress response. So rather than give testosterone in this case, it makes sense to treat the stress and then think about how we would do that. This could be giving more of a focus on counseling, but also surrounding them with supportive ideas. And this is one of the things that we do at Incubator, make sure that you have handouts available and resources available and things that we've all tried in the community. So there are various apps that get suggested, even talking about things like how to utilize heart math or thinking about vagal nerve exercises, and then getting back to what are the nutrients that support the adrenals, like B5 and B6 and vitamin C, and how do we use these things to surround our patient so that they become more resilient in the face of stress. We are never going to have the answer to every stressful situation that our patients encounter. In fact, there's no magic wand, as much as we wish there were. We can't take away the loss of a loved one or financial hardships, or when one is faced with a challenging situation around moving or a kid or a pet or whatever that stress is to our patient. However, what we can do is find ways to help them be more resilient in the face of stress. And so it's so nice to come together at Origins and talk about this, to have this community where we can brainstorm together things that have worked, avenues that we've taken, be able to share handouts together, and ultimately make sure that we have a strategy to deal with what so often is at the heart of why people have chronic disease.